Hi guys, my name is Tyler Estes, and the study that I was assigned is called County Level Socioeconomic Factors in Residential Racial, Hispanic Poverty, and Unemployment Segregation Associated with Drug Overdose Deaths in the United States. Just a bit of background, total drug overdose deaths from 1999 to 2014 were increasing quite substantially. There were significant differences in mortality rate by geography, specifically with state to state and county to county discrepancies, which indicates that geographical factors may be at play here. Also, previously, research has demonstrated that social factors are heavily involved in drug use, and there's little existing data related to residential segregation's impact on overdose deaths. The objective of the study was to evaluate overdose death rates in relation to socioeconomic characteristics and measures of socioeconomic residential segregation at the sub-state geography level. As far as the study design goes, they really could have used a retrospective cohort or a case control. It was just a database analysis, so they just pulled data from existing data from databases and just kind of ran some statistics on it. But I think they chose a case control here because they really wanted to look at something that is an uncommon outcome, namely overdose deaths. And thankfully, that's not a frequent outcome among the population. So they went with the case control here and started with the outcome and then worked backwards to find risk factors. As far as the inclusion criteria go, they had to have overdose death rates overdose deaths between 1999 and 2015 while living in a county defined as socially vulnerable, using the definition of social vulnerability from the Social Vulnerability Index from the Agency for Toxic Substances and Disease Registry. As far as data collection goes, they identified a lot of the death statistics, total deaths, death by race, death by Hispanic ethnicity, etc., from the CDC database from the years 1999 to 2015. And as far as the social and demographic characteristics, they used the American Community Survey from 2010 to 2014. As far as measurements go, this is where it gets really challenging and interesting. Residential segregation is very hard to define. There's very little research done on this, so they kind of had to create a definition here on the fly. They used dissimilarity, which basically was examining the demographic factors of a local population versus the surrounding populations, and they compared it to the surrounding counties as well as the surrounding state. And then they use diversity, and really here they kind of used mixed race individuals as a gauge of diversity. So they used kind of mutually exclusive racial categories. So if somebody identified as just white or just black, they use those as like a measure of anti-diversity almost, and then assumed that everyone who identified as multiple races was mixed race and therefore an indication of diversity because of a lack of social segregation, because clearly the people from different racial backgrounds were interacting. They also examined just generic categories that are well quantified in other research, including race, poverty, unemployment, and all the other things you see listed here, and ran a bunch of Pearson R correlations just to kind of gauge whether or not their data was consistent with existing research. As far as statistical analysis goes, they use primarily incidence rate ratios, which is basically just taking the incidence in the study population and then dividing by the incidence in the standardized population. So in this case, they would look at something like an area with high white-black dissimilarity versus the incidence of overdose deaths in the U.S. as a whole. And then, like I mentioned previously, they ran a bunch of Pearson correlations for various demographic factors as well. As far as controlling the study, they tried to eliminate confounding with age because specifically people over age 65 and under age 18 were much less likely to die of an overdose death. So they realized, again, like we did with some of our assignments, that standardizing the population was important here because a lot of smaller sample sizes may have skewed data where a large portion of the population is either older or younger than that age limit and could mess up the data. So they standardized the rates for those. They also broke the counties into groups of greater than 10 and less than 10 overdose deaths. And for those less than 10 deaths for the whole county, so the smaller sample size counties, they ran a separate set of calculations where they inserted a random number between 1 and 10 for all of those counties. And got very similar data, but they used the data that they got doing that to adjust the standard error measurements because of those small sample sizes. And they also provided the data on this just to be able to look at. As far as the results go, there were less overdoses in those in poverty. There were more overdoses in unemployed whites, but less in unemployed Hispanics. And there were more overdoses in areas with high white-black dissimilarity, specifically more with a higher white-black dissimilarity for the county-to-state level versus the county-to-county level. There were a number of other results, but most of them were insignificant, and the authors didn't discuss those very much. As far as biases, confounders, and other problems in this study, the authors noted that state level policies differ considerably. So when they're comparing county to adjacent county, if the counties are on opposite sides of a state line, that can be challenging because those policies are obviously going to affect things like drug use and health care. So those are going to be confounders there. And then some counties with smaller population samples, we're not really sure if that's truly representative of those samples. Again, we got very similar numbers when running the same calculations with random numbers between 1 and 10 for those with small sample sizes. And then also there's a lack of control for other variables like smoking and other health risking behaviors that could account for some of the drug use behaviors and overdosing. This is just a problem with retrospective studies in general. You don't have the luxury of controlling for a lot of things when you're not intervening. As far as some limitations of the study go, all ecological level studies are not, you're not able to just apply this in every individual case. Obviously, individual circumstances are going to differ. They weren't able to look at a neighborhood level, which is what they really wanted to examine. So it may be necessary to break down social strata further in order to get a better picture of what's actually going on here. And then again, the low sample sizes for some communities, it's hard to tell if that was truly representative of those counties. As far as conclusions go, poverty could be a prohibitive factor for drug use. Unemployment may have a higher mental toll on whites, and the authors repeated quite a few times that much more research needs to be done here, and they kind of felt like they were stepping out on a ledge with the study because there's just so little research done that they kind of had to make up a definition on the fly, and they were very cautious with positing these conclusions as well because there's just not enough data at this point in time. Thanks, guys. Would love to get your feedback, comments, questions, whatever. Appreciate it.